And if I could ask people to switch their cameras and their microphones off for the beginning, you'll see that the recording is just about to start. And you will be invited, when we get to the panel session, to put your cameras back on when we have the discussion. The event is being hosted by the Centre for Justice Innovation. For those of you who may not have come across their work before, they're a non-profit UK-based organisation working to build a justice system which every citizen believes is fair and is effective. They have a number of different areas that they focus on, including pre-court diversion, court reform, problem-solving courts, smarter community sentences, and just generally promoting the best in British justice innovation. Their website can be found at justiceinnovation.org. And having had a look at it myself on several occasions, I have to say it's full of really interesting and useful information. Just to reiterate, the event is being recorded today. If you don't want to be on the recording, then please do keep your cameras switched off at all times. There will be an opportunity for people during the Q&As to switch their cameras back on and to ask questions. When we get to the Q&A, I'll remind you again about using the hand features in order to be able to ask questions. And of course, there is always the chat function as well, which you are invited to use. Okay, so without further ado, I'd just like to welcome the researchers. If I could invite Hannah and Carmen to switch their cameras on. Lovely. And we've got Hannah there as well. I'll leave you to introduce yourself, but you're going to tell us a little bit about the research report and give us a flavour for the findings. And the report will be circulated after today's event, so you'll have an opportunity to read more about it then. So over to you two then. Thank you.
Great. Thank you so much, Lindsay. So my name's Hannah. I'm a research officer at the Centre. And today we're going to be presenting the findings from a research project we conducted this year, which looked into understanding and filling the gap in advice and support services for people with low-level criminal justice involvement. And this project was funded by the Lloyds Bank Foundation. And just to put into context, this research report is part of a larger project that we're doing on this topic. So following this research report, there will also be a policy briefing and engagement with national and local policymakers, as well as a toolkit looking at this area of work. But today's presentation will specifically focus on the findings of the research report. So to kick off with just a bit of policy context before I launch into telling you a bit more about the findings. So in general, there's an evidence base which suggests that there's a high prevalence of social welfare need amongst people with criminal justice system involvement. And in particular, there's well evidenced links between having unmet social welfare needs in areas such as accommodation, employment and debt, and involvement in offending. And in addition to that, there's an emerging evidence base that preventative or early interventions in these areas can sort of stop these issues from becoming severe, so escalating to things like homelessness or chronic substance misuse, and that these preventative early interventions may prevent people from becoming involved with the criminal justice system further or repeatedly. However, despite the fact there's an evidence link between unmet social welfare needs and offending, there's no systematic offer of support with social welfare needs for most people with criminal justice involvement, with most of the resource being focused on people who have committed more severe offences and are involved with probation, and this group tend to receive complex needs assessment and are linked up to interventions through their sentencing. In addition, we have liaison and diversion services targeting people with more clinical needs, such as mental health, learning difficulties, and substance misuse, instead of social welfare needs. So addressing those things I mentioned earlier around accommodation, employment, and debt. So in light of this, there appears to be a significant gap in provision for a lot of people involved with the criminal justice system with unmet social welfare needs that may be driving their involvement with the system. So in light of that policy context, we really wanted to understand more about the social welfare needs of people in this low-level justice system involvement group, and sort of understand what support services they're aware of. Have they sought support to try and resolve social welfare needs? What have their experiences been like? Have they encountered any barriers or obstacles when trying to access support to address these needs? And finally, we really wanted to try and understand what effective practice and effective provision with people with low-level criminal justice involvement should look like. And really, what people's wants and needs were around this, as well as what the core elements of the more positive experiences they had were. So in order to answer these questions, we employed a qualitative methodology, and we conducted 15 semi-structured interviews with people with experience of the criminal justice system in London. So all the people we interviewed had a recent experience of attending court as a defendant, although most of them had not received community, suspended, or custodial sentences as a result of attending court. And we had sort of a split within our sample of people who had been a defendant once and people with more criminal justice involvement. And before we interviewed people, we also administered a screening questionnaire to everyone before the interview, sort of asking about areas in which they'd sought support for within the past 3 years. And what we found from the screening questionnaire was needs around debt, housing, and mental health were most prevalent within the sample, with sort of around a third of people in our sample having tried to seek support or having received support in these areas within the past 3 years. But what was really striking was when we did interview people and ask them about their needs in that context, a lot of undisclosed needs emerged, which we either hadn't included in our screening questionnaire or people hadn't felt comfortable seeking support for or known about any support for. And in particular, needs around neurodiversity, learning disabilities, needs with reading and writing, digital illiteracy, particularly with older respondents, emerged, as well as other needs such as having English as a second language. Another striking thing was a lot of people disclosed having needs around mental health, which they hadn't sought support for, which was why it didn't show up in the screening questionnaire. And then just a brief note around the people in our sample that had more than one need, which again was just over a third of people that we interviewed. They saw their needs as being fairly interlinked and complex. So we had people going through the system as defendants who were also victims of domestic abuse, who as a result of that were experiencing mental health issues, were also sort of had accommodation needs arising from that as well as people sort of with chronic employment and housing needs, which sort of led to aggravating mental health issues and then in turn substance misuse as well. So now I'm going to hand over to Carmen, who's going to talk a bit more about awareness of services within our sample.
Thanks, Hannah. So when we asked what community support they were aware of, interviewees cited a real range of services, from national to local, general to more specialist. And there was notable reliance on councils and services like Citizens Advice, not only for providing general advice, but also signposting and onward referrals to more specialist services. And the specialist services that interviewees were aware of, without having been signposted, included Mind and Samaritans for mental health support, Women's Aid and Refuge for domestic violence help, Job Centre, Legal Aid, among some others. In terms of local support, interviewees have used one-stop shops at local civic centres and also specialist issue advice clinics, most commonly covering housing. I think really strikingly for us, several in the sample were just unaware of specialist services for particular needs, really underlining the importance for signposting and onward referrals and active outreach where that's possible. So in terms of sources of awareness, interviewees pointed to some services just having being common knowledge, having a really well-established reputation. I think Citizens Advice was the one that we had again and again in those terms. It was really seen as a first port of call by many people and the first avenue for support that family and friends would suggest. So you can see that from this top quote. I think Citizens Advice, they've just been around for years, and you always hear people, have you called Citizens Advice? Have you gone to Citizens Advice? The interviewees we spoke with who had experience of hybrid community advice really valued the direct approach by staff. So being proactively kind of sought out when asked if they needed help. And several said without that, they wouldn't have known that the service existed or what support was on offer. Unsurprisingly, internet searches were quite heavily relied on, especially by the younger participants. And word of mouth seemed to be quite important for local services, particularly those that didn't have a well-established web presence. Interviewees also pointed to leaflets and posters, onward referrals, like I've mentioned, and just passing service buildings as being kind of key to their awareness about what's on offer. But despite all of this, there was a certain sense among some interviewees that advice and support services operate under the radar to an extent, and deliberately so. So one interview said, they never tell you about these services, it's up to you to find out. So having talked with interviewees about their kind of understanding and awareness of the service landscape, we moved on to delving into the barriers to accessing those. And the issues that interviewees raised tended to fall under three categories. So those are practical barriers, negative perceptions of services, and past negative experiences with services. And so I'll take those in turn. I think far and away the most common frustration, practical frustration, was around difficulty contacting services. So this quote at the top was quite representative, and quite a few interviewees had the same experience. You've got an email address, you've got a phone number, emails don't get picked up, phones are constantly engaged, something is not right here. So just making initial contact, leave alone actually receiving the advice or support that they were after, was often quite a time-consuming process. And some interviewees reported queuing kind of hours on the phone, and they were understandably quite angry at the perceived disrespect shown for their time. The next practical barrier was around inconvenient service locations and opening times. So interviewees pointed to more national services now having a smaller physical footprint, having closed branches, which obviously caused inconvenience. And there were also queries around opening times being restrictive and not especially accessible for those on 9-to-5 jobs. A big frustration was long timescales for support. So some services couldn't be relied on to provide timely advice, which obviously is especially concerning where the issue at stake is an urgent one. So, for example, seeking advice around an imminent eviction. The long delays were generally attributed to a lack of funding, but also there was lots of acknowledgement of the role the pandemic played, and services really grappling to tackle backlogs from that. Also, we saw the impacts of specific vulnerabilities that Hannah's kind of already flagged. So several interviewees had characteristics and vulnerabilities which created additional barriers or additional issues accessing services. So one of our community advice interviewees had literacy issues and was really only able to avail herself of support because someone approached her. She wouldn't have been able to really tap into that support if she had to rely only on written materials. And we also had people say they just hadn't thought to access services because one person said that they're just not very technological. So issues around logging in and digital literacy there as well. Thanks, Hannah. So next, poor perceptions of services, and I guess the most kind of obvious barrier was the perception that there just aren't advice and support services available for a given need. So, for example, one interview said, I wasn't aware there were services out there to help with benefits. They wanted to know what they were eligible for and how they might go about accessing those. In a similar vein, people kind of just assumed that, for example, legal aid had stopped running. So, and not very solid awareness of the landscape. There was a mistrust of services, so around public services in general. One person said it's all money driven, people trying to help you for the benefit is wiped out of the window. And some saw advice and support services not really as independent, but as offshoots of government. So they weren't seeing them as benevolent, they weren't seeing them as impartial. Then there's a really notable scepticism about quality of some services. So especially reservations around voluntary sector services when compared to what interviewees saw as more formal, more professionalised routes to support. So around mental health, we saw interviewees compare kind of mental health helplines to GPs or private therapists. There was also scepticism that it was widely assumed that these services are underfunded. So there's scepticism from there of how well equipped these services are to provide good quality advice and support, even though for the majority they saw these services in a really positive light and were very appreciative of their help. And some scepticism stemmed from hearing other people's negative experiences, which obviously coloured interviewees' own perceptions. So I appreciate there's the job centre, but I don't think they're very helpful. I've just heard from a few people that they're just not very good. There was also some scepticism about the confidentiality and sensitivity of services, with some interviews not really trusting certain services to be discreet or to sensitively deal with what are very sensitive issues. So the last of these categories of barriers is around negative experiences receiving advice and support. So already having experience of it. And a big frustration was inflexibility. So interviewees were frustrated they couldn't easily reschedule appointments. They didn't really have a say in when the appointment was. And some even reported being cut off from support, having missed an appointment. There was also inconsistency of staff, which meant that some interviewees faced constantly having to retell their story, and obviously given some of the issues at stake, that could potentially be re-traumatizing. So this top quote, I think, sums that up. It got chopped and changed about 3 to 4 times. At the end, I said, you know what, I can't keep telling my story. It's mentally draining that I can't do it. I can't keep doing it. I've already pointed to kind of the impact of pandemic in regards to really long delays people were seeing. But another thing that interviewers highlighted was the real dearth of in-person support during lockdowns and even following that. And several interviews really valued that face-to-face interaction, especially when opening up and discussing very sensitive issues. Interestingly, some of the interviewees kind of just assumed that would be a new way of working, that more online remote working, even post-pandemic. And that assumption made services less attractive to them. So obviously, again and again, we heard about the impact of criminal justice system involvement on our interviewees, and we just wanted to kind of flag the kind of things that they were talking about. So obviously, they found it to be an additional stress in their life. Many didn't struggle to understand the offence they'd been charged with. They found court to be a disorientating environment, understandably. They were unfamiliar with the process and they didn't really know where to turn for support. Some interviews were involved in concurrent proceedings, and at that point it felt like the justice system was really an overwhelming part of their life at that point. Interviewees discussed criminal justice system involvement, exacerbating welfare needs and creating barriers to accessing support. So they described going to court aggravating mental health issues, being disruptive to their employment and also to their childcare arrangements. Ongoing court cases and the imposition of fines really drove existing worries and created new worries around money. And obviously this involvement just left them with less time to really grapple with their issues and be able to seek support. And those interviewees with long-term criminal justice involvement, and that constituted a very small number for our sample, they did tend to have more chronic and complex welfare needs. Hannah, I'll pass over.
Great. So yeah, just to round off, I'm going to talk a bit more about what effective provision with this cohort should look like. But before I launch into that, I'm just going to say a little bit more about the Highbury Corner Community Advice Service, which is a service based in Highbury Magistrates Court that we as the centre sort of oversee. And within the 15 interviewees that we talked to for this project, we recruited 5 of them through Highbury Corner Community Advice. So consequently, as a result of that, quite a lot of the data we got from interviews was about the Highbury Corner Community Advice Service. So in light of that, I thought it would be good to tell you a little bit more about the model before I go through those findings. Yes, so as I mentioned before, Highbury Corner Community Advice is a support and advice service which is co-located in Highbury Magistrates Court, and it provides signposting and referrals. It's been open since 2014 and it's based on the CAS Plus model, which is a model which is in operation across magistrates courts in Devon and Cornwall. And the service is designed to support people with low-level criminal justice involvement. This could be victims, defendants, and witnesses. And it aims to sort of help them access community support services to help address any unmet needs that they might have. And the Highbury Corner Community Advice Service does this through conducting initial assessments of people's needs and then providing signposting, advice, and support where necessary on issues that they present with. So we did speak to 5 people who had used this service. And what's really noticeable is the strengths they perceived the Highbury service having. They were notably aligned with what the other 10 interviewees we had in our sample were talking about in terms of what they would really value in terms of what services provide. So based on our 15 interviews, these sort of 5 key principles of effective provision emerged. And I'm going to go through each of these in turn, but broadly, ease of access, consistency, sensitivity, criminal justice awareness, and a whole person approach. And it's worth flagging as well that not all of these necessarily apply to every service. Some of them are more relevant for more general support, signposting and advice services. Some of them might be more relevant to specialist services, and some of them might be relevant to all types of service. So to begin with, I just want to explore ease of access. And ease of access there was a high demand for this in the sample, and looking at the people in our sample that had used the Highbury Community Advice Service, being approached proactively by the service was something that they really valued. A lot of them reported sort of sitting outside of court in the waiting area and then being approached by Highbury Community Advice staff and proactively asked about their needs. And this was really seen to mitigate barriers, as you know, it was seen that the service wanted them to use it, and the onus wasn't put on them to reach out and make that contact. Another really important theme emerging, especially out of the context of the COVID-19 pandemic, is that services should be available in person and should be delivered with some flexibility. So we had some really positive examples of people using walk-in services or one-stop shop kind of civic centres, and they just really appreciated that service being delivered from a discrete location and then sort of being able to walk in sort of as and when needed. Another really important facet which emerged was that services should be easy to contact. So you should be able to easily get through and again, be able to walk into the service in some instances. And having some flexibility around appointments was also important for people in the sample, as well as some choice in how you communicate with the service, especially if there's maybe some ongoing communication. So a choice as to whether you communicate via phone or email. On from accessibility, consistency was another really important theme, which our interviewees emphasised. And a lot of them really valued having familiarity and rapport with service staff. Interviewees that had used the Highbury Community Advice Service reported being on a first name basis with the service staff, which was really good at mitigating their discomfort around using the service because they felt known and they didn't have to retell their story. We also had some positive examples around this of people who had used IDVA services in regard to domestic abuse and other services where there was an element of casework because they had a clear point of contact within that service who was able to give them updates and who they were able to approach with any questions. Obviously, our interviewees were aware this was not feasible throughout all service delivery and all services. And yeah, if this wasn't possible, interviewees emphasised accountability as being really important. So if you are dealing with multiple different staff, just ensuring that there's very detailed handover notes about a service user so that they do not have to retell their story or re-explain things every time they are in contact with that service. Following on from that, sensitivity emerged as a really key principle that was really important and valued by interviewees. And this sort of relates to feeling safe disclosing issues. A lot of people in our sample felt a lot of stigma around the issues they were experiencing, particularly relating to mental health issues, debt, substance misuse, and sort of feared being judged by service staff for this. Additionally, people also felt a stigma attending court as defendants on top of this and were worried about being judged. So it was really important to the majority of interviewees that they felt safe disclosing these issues to service staff and did not feel like they would be judged for the issues they were experiencing. And this also leads on to a point around confidentiality. This was really important in creating a safe space to talk about these issues. And similarly, a lot of people within our sample were worried that their unmet social welfare needs would go on their record in some way. So it was really important for staff to make assurances and clearly outline how their information would be used. And another key aspect of sensitivity in terms of delivering these services was ensuring that protective characteristics are catered for and that staff can tailor their delivery of the service to accommodate particularly differing communication needs. So as Carmen said earlier, we had some people in our sample with needs around literacy, reading and writing. We also had some older respondents with memory and cognitive issues. So in those instances, it's really important to make sure information is accessible. And also, we had one really positive example in the Highbury Community Advice sample where a respondent had memory issues but needed to make a phone call to sort out an issue they were experiencing, and the staff supported that person to make the phone call and let them make the phone call within the service. So if they did have memory issues during the phone call, the staff were on hand to kind of prompt them and get them back on track with the purpose of the phone call. And that was really, really appreciated by the interviewee. Particularly with this cohort, a really important theme that emerged was staff having some criminal justice system awareness, because as Carmen mentioned earlier, going through the criminal justice system aggravates and exacerbates existing needs. And on top of social welfare needs people might be experiencing, they also have questions about the criminal justice process. And in light of that, it's really important that service staff sort of understand what the impact of going through the criminal justice system is on people, but also have some knowledge of procedure within the criminal justice system and help service users to break down the criminal justice system terminology. And yeah, just generally have an awareness of how going through the system may link to other issues they're experiencing in their life. Finally, a theme which emerged was around services adopting a whole person approach. And by that, people really valued, particularly in terms of general advice services, when services screened for a range of needs, particularly at first contact, and were able to respond to all of these needs in some way, whether or not that was through providing specific provision or having sort of a rich knowledge of other specialist services in the area that they could then link that person up to. And we saw examples of this within more general services such as Highbury Corner Community Advice, but also within more specialist services. We had a positive example of an interviewee having some engagement with Refuge for domestic abuse, but also feeling like that specialist service asked her about a range of other interrelated needs in her life and was able to then provide support options for that. And another component of this whole person approach is the service being joined up to other services, which can provide support in other areas of need that are disclosed. And in particular, people in our sample really appreciated onward referrals as opposed to signposting. So when the staff actively take a role in linking them up to further support. And people also mentioned really appreciating being offered some kind of interim or phased out support when going from one service to another as well. So now I'm just going to move on to conclusions. So in general, our findings demonstrate a clear need for a specific response to social welfare needs of people with low-level criminal justice involvement, and really illustrate that there is a gap in provision here, sort of through people's low awareness of services and through the range of barriers that they've experienced trying to access support. And our findings also demonstrate that there is a high level of unmet social welfare need within this cohort, and that often needs are sort of interlinked as well, and as well as that linked to being involved with the criminal justice system. And our policy review found there's no cohesive approach to providing systematic support for this cohort. Even though providing effective and appropriate advice and support has the potential to play a role in long-term crime prevention, as well as stop sort of issues becoming more chronic and complex. So from our interviews, we identified the principles of effective service provision with this cohort. In particular, services should be easy to access, services should be sensitive, services should be consistent, and a whole person approach should be adopted. And as well as that, specialist knowledge of the criminal justice system was really valued by people going through the system at the time. So just a brief note on our next steps as well. As I mentioned, this is part of a broader programme of work exploring and filling the gap in community support and advice services for people with low-level criminal justice involvement. And it has been really generously funded by the Lloyds Bank Foundation. So following this research report, we will be releasing a policy briefing within the next few months, sort of articulating sort of the problem as well as potential solutions to providing better support to this cohort. Following that, we will be engaging with national and regional policymakers on this issue. And in terms of our Highbury Community Advice Service, a toolkit which explores the community advice model is also being developed and will be released within the next few months as well. And I should also say the centre does provide support around establishing the community advice model. So if you do have any interest in the model or implementing it within your area, then please do reach out to us. There is some information about that on our website. So that is everything from us. And thank you very much for listening.
Thank you very much, Hannah and Carmen. You've put up a slide saying questions, but can we leave the questions till we come back to the panel? Is that okay? Great. Okay, because we're just running a little bit behind, but I think was a very full and very interesting take on the problems that are facing offenders. And also the problems that are facing services in trying to access this group that has such high level of social welfare needs. So very interesting. I've got loads of questions myself, but we'll leave those for the panel discussion later. So moving on, I just quickly wanted to introduce to you the two additional panel members who will be joining us. And first of all, just to say we had apologies from Paula Harriott, who unfortunately is not feeling very well today. So one of her colleagues, Femi Leri Adekimi, has very kindly agreed to step in at the last moment to represent this viewpoint, and he's a star for doing so because it was very short notice. So if I could invite Femi and Liam to switch on their cameras. Thank you very much. And could I ask you both to start off by just introducing yourselves and saying what your level of interest is in this particular piece of work, and maybe just for 5 minutes or so, and then we'll move on to more of the Q&A. So Femi, could I start with you? And once again, thank you so much for stepping into the breach.
No problem, Lindsay. Thank you. So yes, my name's Femi. I work at the Prison Reform Trust with Paula Harriott. I'm on Paula's team, the engagement team. We've both got lived experience of the criminal justice system, and we've seen how some of the needs that were brought out and highlighted in the report have affected people who've been in contact with the criminal justice system or even spent time in prison. Something that is very important to us as people with lived experience is that we provide some kind of support or help to these people who need help with the needs that have been highlighted in the report. And so we do have a vested interest in the work that has been done by the Criminal Justice Innovation. And it's so important that we remember that these people potentially could have been helped, as is highlighted in the report, could have been helped from an early point in their journey with the criminal justice system if they'd had access to certain support services, or even just been aware that they could get involved with some of these support services. But something that we found from our engagement with our prisoner network is a lot of people aren't aware of the support services that they can make use of and avail themselves of. And it's not necessarily because the support services aren't doing their best to get out there, but sometimes the needs of the people prevent them from being able to access these services or find out about these services. So they need other avenues, different ways that they can be presented or made aware, informed about these services that they can use in order to help them before they get into situations that only exacerbate the problems and issues they have, like homelessness and debt, which only produce a cycle that can lead to more serious reoffending. So it is important, the research that has been done, the points that have been highlighted in the report are paramount and so imperative to be focused on. And we really need to, as people who maybe work in the sector or work alongside the criminal justice system, try and help people to get in touch with these services so that they can exit the cycle of reoffending or even beginning down that road before they get onto this road. So yeah, very important, this work that's been done.
Thank you very much, Femi. Liam, tell us a little bit about your work.
Hi all. So yeah, I'm Liam. I'm the manager of the community advice team based at Highbury Corner Magistrates Court. Hannah's already explained very well who we are as a service and what we do, and obviously some of our clients had some input into the research that was undertaken by Hannah and Carmen. So yeah, I won't go too much into the service because obviously it's been explained, but I just want to highlight a bit about what I've found from the findings, which are so important from my side and what I see every day in the service. So there's obviously this talk about barriers so often in this field, the barriers to advice. Lots of people understand that they need the advice and they need the support, but there's so many barriers that are put up in these places to stop them. So yeah, from us, I just want to highlight the ease of access, really, that what came out of the research, how important it is to the clients we see every day, and what we offer as a service can probably sometimes not seem that very different to what Citizens Advice do. We're a generalist advice signpost information service, but the clients we see day in, day out that want to see somebody face to face, they want to sit down and speak to somebody over the phone, in person. They don't want to kind of wait on the phone for an hour and then have to wait a week for another appointment. So that's what was so vital for these people sometimes, just to, when they are ready, to pop in. So knowing that the service is open Monday to Friday, 9 to 5, even if they pop in and we might be busy, sometimes I only have to wait half an hour, 45 minutes. So the importance that people can do it on their own time when they're ready, when they want to access the service, and it be in a way they want to do it. So they can choose whether they want to see somebody face to face or they want to pick up the phone and call us. Yeah, so the feedback we get every day is, although we might not differ from a lot of services out there, the flexibility and the access that we offer can be a huge difference for those people. And also, I just believe, in the same time, like Femi highlighted, people that may be aware of the support needs, but the barrier can be their support need themselves. If people are struggling with homelessness or substance misuse, they may lead a chaotic lifestyle, and trying to find that specific time when they are ready to engage is quite important. So if we can find someone at a time when they're in a stressful situation before court and they've got an hour spare there and they've got nowhere else to go because they're waiting to go into court, is sometimes an absolute prime time for them to say, right, I'm going to actually sit down and do this benefit application. And we can do universal credit application there and then if we have time with that person. And it kind of gives that chance to capture that moment when they are ready to engage with that support they want and need. And yeah, so the idea that once they leave that courtroom, you know, it's so easy to then go to the back of their mind and it could be distracted by many other things going on in their life. So having that sort of accessibility and ease in that moment allows you to catch that person at a time when they most need it. And I think we see the benefits of that day in, day out at Highbury.
Okay, thank you, Liam. And I'm particularly the emphasis on that face-to-face service, I think is very interesting, particularly when the drive at the moment is towards efficiency, which is about getting people through, which leads to more services going online and telephone access. So okay, that's really useful and very interesting. So we now have 4 panel members who are all here and ready to answer questions from the participants. Just to say, if you would like to ask a question, you have 2 alternative ways of doing so. You can either raise your hand, and there are people who are checking out hand raising function, who will invite you to speak, or you can pop a question in the chat and we will pick it up that way. I think there are so if you are invited to speak, please switch your camera and your microphone on again so that we can see you. And I think there are so many interesting aspects to this work that We have just over half an hour in which to kind of have a sort of deep dive into these reports and the findings, and indeed what's going to happen next. So please feel free to ask questions. We have a hand raised. Let me see. Ah, okay. It looks to me as if that's Chile Reid from Advice UK. Chile, would you like to ask your question? Thank you.
Yeah, thank you, Lindsay. And great to Femi, that was brilliant. That was also brilliant, Liam, which sort of brought to life the findings, which I think are fascinating. I did, a lot of it was awareness raising or mentioning awareness, why I put in the chat a bit earlier, the fact that Advice UK has 210 members in London. And maybe not people aren't aware of them, so I'll share the website as well, because I think we've got quite a low presence, but a low profile but massive presence. So I put that in the chat. But what really strikes me, and I've always been, and I met Liam last week, which was really inspired by our meeting Liam, and I've spoken to Duncan Lugton previously, and in fact Stephen Whitehead about 3 years ago, I think, is a fascination with criminal justice and social welfare. But what really strikes me is how, when Liam was describing what you do and what Femi describing what the needs are, is just how few MAGs or magistrates courts have a community presence. And I know from experience of setting one up at Greenwich Magistrates Court years ago, the massive difference it can make. And Liam, you described fantastically, I think you said it was accessibility in the moment. And Femi said, yeah, people may not be aware of the services. That's the issue. It's that they're not that. I think early on, some people fed back saying they felt disrespected or intentionally under the radar, which I think is probably not fair to advice services generally. It's sort of coming together of supply and demand. So my thought and my question is this. Presumably, Liam, if your service is as good as it seems to be, the magistrates, if they are magistrates, or district judge, if they are at Highbury and Islington, will think it's a brilliant service, a professional service, and saves them people being, I suppose, not unfairly convicted, but it's reduced conviction rates. The whole post approach is absolutely brilliant, and it probably saves them money as well, not just in the sort of process of going through court, and money obviously talks in the court system. For me, it seems staggering that so few magistrates courts have a service like the one that you've set up and established. And I think anybody on this call, and I include myself in that, should be fighting to talk to the Magistrates Court Association and others, and maybe using testimonials from your magistrates, if you have magistrates there, about raising the profile and saying, actually, this should be something that we should fight for in every single magistrates court in the land. It shouldn't be a sort of super discretionary thing for the CEO or the court the justices of a particular magistrates court, and we should sort of make a national movement. And I think you've mentioned the toolkit before, but I think this is a really big, massive thing, and I think the selling point is it saves money and time, and less people being serving custodial sentences, all the crap that brings around. So I just think that we've got a lot of energy around this. We could offer to talk to you about this further, and especially getting that toolkit out, but talking to the Magistrates Court Association as well. Brilliant work. That's fantastic great. Inspiration. Thank you, Lindsay.
Yeah, thanks, Chile, and that's a really great offer to pick up on this later. And I think your point about the cost element of it links with a comment that's been made in the chat by Robin Bridging the Gap, which is about the robust evidence linking the availability of advice to reducing crime. Which would be a key kind of lever for us to get funding for this work. So would one of you like to comment on that, on some of the points that Chile has raised, and that issue of the evidence base linking to reduced offending, hence reduced costs? Femi, did you want to go first? I can see you shaking, nodding your head, so.
Well, yeah, I mean, it's always such a big thing that's made by the government on how much they're pumping into criminal justice, and yet it seems that there's very little support, if any, in trying to prevent people entering the criminal justice system in the first place. it's almost an indictment on society as a whole, that we don't provide support and care for people in our society who are usually the most vulnerable in the society, until something really bad has happened to them. So I agree with what Chili's saying. I think it could potentially start even further back than just at the magistrates' courts. It should start when people are just living in society and are starting to experience the difficulties. That's when they need to access the support they need in order to prevent anything worse happening to them. So yeah, I do agree with what Chili was saying.
Thank you very much. Liam, what's your thoughts on some of this?
I was just going to pick up a bit on the data to show the support offered by these services and the reduction in crime. And I think it's one of those, I think Hannah and Colin might know obviously a bit more, being the research experts around that, what we can actually prove from it. But it's in terms of sort of concrete physical evidence that there is a direct link between what we are offering and a reduction in crime is pretty hard to present as a direct link. There's a lot of like sort of soft outcomes that you can kind of show that definitely does relate to them not returning to court. We track the people that we offer support to. We continue work with them over a period of months. We check in with them, and we do track whether they are returning to court, whether they've had any more experience in the criminal justice system since they have first met with us. And it's quite obvious to us sometimes that this person being referred to a drug and alcohol service and suddenly engaging with them, and then they haven't come back to court 3 months later because they haven't been shoplifting, because they haven't had the need to do that, is probably a direct relation between the referral we've done and engagement they've had with that service. But the physical proving that data physically to say we did this, stop that person coming back to court, is quite hard to nail down exactly, although we all probably know that it played such a big part in that. Yeah, I don't know, do you have any more to say, either Hannah or Carmen, on the proving of the data side of that?
Yeah, I think that's exactly right. I think it's often, I guess, working in this service, you must kind of take it for granted that by kind of addressing these underlying factors and underlying needs, drive offending, obviously, that's going to lead in the long term to less offending. But that's really hard to evidence. I think there's we do a lot of work around diversion, and kind of underpinning that is if we kind of intervene early at low level involvement and we kind of address those underlying needs and those criminogenic factors, then we're kind of saving a lot of hassle in the long run. But yeah, it's about evidencing that, and there's not a whole lot. Obviously, that would be a longitudinal study, so there's not a whole lot to draw on. But I think a lot of this is like self-evident, isn't it? If we're tackling those things that are driving offending, that's what's going to make the difference.
Thanks, Carmen. Hannah, did you have anything to add?
Yeah, just a brief note that in our report, which is being released obviously after this event, we have summarised some of the more like broader literature around the role of criminogenic needs in driving offending. But again, as you said, there's sort of a dearth of evidence around this cohort. So it is sort of more general, the evidence that we've reviewed there.
Okay, thank you. That's always useful to see. And I've got an idea for how you could do this, which would be using matched comparison groups from criminal justice data. So if there's anybody on the call who's interested in doing further research on this, I think it's actually perfectly doable. But anyway, we have a question from, or a hand up from somebody who's entitled Admin External. Can you reveal yourself, please?
Yes, apologies.
Lovely. Hello.
Apologies for that. My name's Sandra Beaton from the Association of Panel Members. I have no idea how to change the admin thing. I've tried so many things, but please accept my apologies. My question harks back to the previous comments and questions. Has the system been formally evaluated at any point in time? If so, what have been the criteria for the evaluation? And moving on from that, there are so many really positive developments in the criminal justice system, particularly my field, my specialism is restorative justice, where this this idea of does it reduce reoffending is so prevalent and is such a huge barrier to actually making the positive developments that are in place and ready to take off and to change the system. They're absolutely in it. The criteria of does it reduce reoffending is a complete and utter non-starter, so that anything that actually helps the people as opposed to that nominal goal, objective, however you want to state it, it hardly happens. And if I could ask a supplementary question of Liam, please, is do you have stats as to what proportion of your of candidates that you work with are in the system because of debt, please?
Thank you. Liam, can you take that part of the question? And also you mentioned about the evaluation, the system being evaluated. Was that the service that's being offered?
That's right, yes. Yes, please.
Lovely. Okay, cheers.
I can start on the evaluation quickly. I know that CAS Plus, which is a very similar service to us, has just gone through a full evaluation, which I believe has been published. Has it been published? I'm not sure. I need to double check that. But it has been recently gone through a full evaluation, and it's available to read through. I'm not the expert on that because I wasn't involved with the evaluation. I don't work for that service, but obviously they offer a very similar model to us, and I know that is available out there to take a look at. And in respect to the debt question, yeah, we do to a degree. So everything, all of the work we undertake is monitored and reported on. It kind of depends on at what stage they come to us, and it's kind of been talked about earlier on that a lot of people come to us with one support need, but the way that we work with clients, it all does reveal itself that a lot of people do have numerous support needs. So we will have some sort of data on people who are in court for debt issues, yes. It might not be, I don't know how extensive the data we will be looking at, but we understand people that are there in the first place because of debt, and that is something that we can draw on quite easily and present to people and make them aware of how many people we're working with those issues. And we are prepared for that to massively increase in the next 12 months and probably take over housing as our biggest client need. We're very prepared for that to become a thing, unfortunately so.
Okay, thank you. But there is something really daft about people with debt going to court and getting fines as well. So there's that whole issue as well. Carmen or Hannah, was there anything you wanted to add to that? No. Duncan has actually put the report that was mentioned in the link to that in the chat. So Femi, did you have any reflections?
Not really. I mean, Liam, he's far more an expert on this than I am. So not too much to add, other than reducing reoffending, obviously is everyone's desire and aim. I understand that as a criteria, it can be a bit double-edged, but we do want to reduce reoffending, and that involves tackling the needs of the people that drive them into offending in the first place.
Okay, thank you. Yeah. And it's also learning how to speak the language that the people with the purse strings will understand sometimes, which doesn't mean that we shouldn't be doing other pieces of work as well, but it does drive us towards particular kind of ways of doing things. Okay, there was a comment in the chat regarding services that are sensitive to people who are neurodivergent. Is there anybody who would like to pick up on that? Let me see if I can just find the question again. Or maybe the person who made it. Right, it was a question from Catherine. who said, is there any more detail on barriers experienced by neurodivergent people and how to resolve them? Is that something that's known about, and in what particular ways, I guess, as a sort of supplementary to that, would services be able to redesign themselves in order to help people in those circumstances? Has anybody got any thoughts about that, or indeed from the panel?
I think one of the things that came up in interviewees and interviews on other projects is that choice of how to engage. So some people might prefer face-to-face, some people might prefer over the phone. And I think there's an element of giving the client a choice in that, and as much choice as you can give them, they can tailor their experience through that. I'm not sure, Hannah or Stephen, if you could comment if there's any particular research that we came across, but I think one of the effective practice principles that Hannah drew out was around sensitivity. You know, it mentioned protected characteristics, but I think also this would fall under that. But an element of choice, I think, in how you want to engage and leaving that in the client's court, I think is important.
Yeah. I just wanted to answer the question in relation to our research sample. So in terms of the neurodiversity we saw in the sample, it was primarily literacy issues within this cohort. But it could also be things aside from, say, if someone has literacy issues, obviously oral information is really important, but someone specifically we interviewed thought having like printouts of information that they could go through with their family from the service was also like really important to them, so that they could sort of take home and go through it with someone that they really trusted. But yeah, obviously, I don't know if Liam has anything to say about any other neurodiversity he's encountered through his work.
Yeah, I don't have loads to add on, like you said, on top of the research. It's obviously something that you do see as something that exists in society, and it's obviously going to exist for people that are accessing advice and support in that setting. So it's something we have come across, and it is something that we've looked at as service before, and had discussions with our team of volunteers about if there are different ways we can work. But in terms of the evidence leading to that, it's not something that we've looked at massively before, and something that probably could be further developed in our service to ensure that we are being as accessible as possible.
Okay, thank you. I'm going to pick up now on a comment that Christina made in the chat. And the question was, where might you suggest an advice service starts in terms of upskilling advisors, upskilling and training advisors around the criminal justice system? And I suppose the other side of that is also about criminal justice workers being upskilled about advice. So where do you think we could look at starting to do some of that work? And how do we sell it to people who may not be particularly interested or overworked in other areas, that this is an important area to be focused on? So let's say, Carmen, can I start with you? Is that putting you on the spot a bit? But
I would say if you're new to the criminal justice system at all, just sitting in on court cases is good. So whenever we go and visit Liam at Highbury, often we sit in and you see the everyday reality of what criminal justice system at the low level, particularly if you're in a magistrate, looks like. You see the delays, you see the issues people are presenting with. You see reliance on legal aid that isn't necessarily working for people. And yeah, so I think that gives a really good insight. And then I think people on Liam's team and with CAS Plus, some of them have past experience working in the criminal justice system or lived experience, and that offers that lens that they can bring it from. But we would obviously be happy to speak with people. We've got lots of resources online that talks about how people caught up in low-level criminal justice system involvement experience the system, what that system might look like for them. So yeah, and you're right, at the other end, it's about criminal justice system practitioners knowing what support is out there in the community, so it works both ways. Yeah, I guess there's a lot of information and practice sharing to be done between those practitioners. But being a researcher, I might leave that to the practitioners.
Okay, thank you. Femi, what about from the prison end of things? How does that work there?
Yeah, prisons are difficult places to get to know at the best of times. I mean, there's a whole sector of organizations who would be happy to work alongside youth charities in the community, to provide information on what happens in prisons, the experience of prisoners as they go through the system. I would suggest potentially getting in contact with people like the Howard League or the Longford Trust, organizations that bring together different organizations and have information and contact information that you can make available to yourself, so that you can contact these organizations for more information from that particular angle, the prison angle. But I'm sure there are also similar resources that are available before it gets as far as prison. Prison's the last straw, really, the last place you want to start. But yeah, from that angle, from the prison angle, there's a whole sector who are happy to talk and work along with youth charities, especially.
Sorry, I also meant to add there's a big it's really well established in youth system, youth diversion, but community diversion in the adult sector is really taking off. And that means that police are really making links with community organisations in terms of advice and support. So I think those links going forward, I think that's a good way in through community diversion and police looking to divert people involved in low-level offending into advice and support. So I think criminal justice practitioners are going to be more open to finding about to mapping what support is available. So I think that's kind of maybe hopefully pushing an open door there.
Okay, that's really interesting, thinking about those different kind of different organizations that are involved with offenders right across the criminal justice system, and where they might all click in is really important. There's some resources that have been highlighted in the chat, which I'm sure will be shared with everybody afterwards as well, about where training can be obtained. And I was also very interested in the comment from Nell Coles, who's saying about some work that's been done in Swansea Welfare Rights, about giving welfare rights training to magistrates, so that you can think then about the sentencing and how the sentencing might impact on people's welfare benefits, which will then lead to loss of housing or loss of employment or family breakdown that can lead to further offending. So that sounds like a really interesting piece of work. Nell, would you like to say more about that, or are you happy to keep it in the chat? Well, hi. Yeah, welcome.
Hi. Well, it was a sort of finite piece of work, really, and we were hoping that it might be taken up a bit more widely, and possibly that will be in the future. We did, I think, 2 sessions, and maybe about 50 people each time came. But it was very basic. Unfortunately, on a more sort of negative point, we've had, and I don't know whether this is the same in other areas, we've had real difficulties persuading the DWP and local job centres to do something about the advance claim issue for people in prison. So we've tried and tried, and we would be really interested if people in other areas have had any success on that. That's such a simple thing you could do to make the situation easier for people coming out. and potentially save a lot of money and a lot of other services. So I can't see the sticking point. The law seems to allow it, if they would make the decision to act on that piece of law, but in our area they're not.
Okay, thank you. Neil, where is it that you work?
Swansea Welfare Rights, it's the local authority welfare rights team.
Okay, all right, thank you very much for that. That seems like a really important point that could fit into a kind of policy kind of strategy, if you like, that could actually make a real difference right across the board for people, really. Okay, there's a question in the chat that Duncan has put up. So a question for the panel, which is, what is the most important thing that community-based services could do to mitigate the difficulties that vulnerable people have in accessing services? So it's a question for the advice sector. What could we do in order to make accessing our services easier for people in touch with the criminal justice system? Hannah, can I start with you?
Yeah, sorry. So you're asking what the advice sector could do to mitigate the barriers. I think, yeah, going back to Liam's reflection, I just think that ease of access point is just so important, or people just feel like the onus is completely being put on them to reach out for advice and support. And I think particularly, you know, where they have a lot going on in their own context, especially because of the unmet needs that they're facing. Like, as I said in the presentation, criminal justice involvement can make people very time poor because they might be going through concurrent proceedings, and it has sort of a big impact on their own finances and mental health as well. So I think just anything you can do to facilitate access and, you know, letting people know that the services are there and that you want them to use them. There was sort of big reservations from our sample that public services didn't want you to approach them, or was sort of being deliberately covert about their service offer or deliberately difficult to access. And as well as that, I think, yeah, especially if you're a signposting service, providing some kind of onward referral as opposed to signposting was really, really appreciated. I don't think we flagged this in our presentation, but people had had really frustrating experiences with helplines, for example, because they felt like they were being given information, but then this whole process started again, and the onus was being completely put on them again to reach out to yet another service, which was quite demoralizing. So yeah, just trying to make it as joined up as possible, but also letting people know that services are there and they do want them to be used.
Okay, thank you very much. I'd like to pick up on another point that's been made in the chat by John Ryan. And John, you work for Stoke-on-Trent Citizens Advice. Would you like to ask the question yourself, or talk a little bit about the work that you're doing, which is funded by an acronym that I'm not sure what that is? So, are you there, John?
Yes. Yeah, I am, if you can hear me.
We can hear you, yes, yeah, indeed.
The acronym is that the DLUHC.
That's the one.
Department for Levelling Up Housing and Communities.
Okay, that's what it's called this week, is it? Right.
That's what it's called this week, as headed by Mr. Gove, I believe.
Okay. Great. Tell us about the work you're doing then, please.
Well, just very briefly, we're supporting service users who have multiple and complex needs, principally around homelessness, varying substance misuse, perhaps domestic abuse. Essentially a cohort that I'm sure everybody in this virtual room is familiar with. The programme itself really is to bring partner agencies together So, for example, Citizens Advice, we have a seat at the table, and essentially customers are supported via ourselves, via housing providers, just as a kind of a wraparound service that each involved agency actually takes to the client rather than the client needing to find the service. Forgive me, I'm not a great public speaker, so that kind of hopefully gives an idea of what it is that we're involved with. It's supported or funded also by the lottery. So it's an amount of money through the local council provided via government and lottery for varying services to look after people with multiple and complex needs.
Okay, thank you, John, and apologies for putting you on the spot there a bit. So
thank you.
I mean, we in the report you did refer to you know, the kind of whole person approach, and I wondered if we could explore that a little bit more. And one of the things that always occurs to me about the whole person approach is we could all become generalists and know a little bit about a lot of things, or should we think about how the whole person approach works in coordinating that support in that way? Because it feels as if there's two sort of models there, and I just wondered, could we talk a little bit more about that and picking up on some of the points that John's made? I don't know, Liam, have you got any thoughts on that?
Yeah, so I think in this field, what we said, coming back to the idea, if you're a generalist advice service, this collaborative working is so vital. I mean, we are a generalist advice. I'm not an expert in any particular field. I may be have more knowledge and skills in certain areas than others, but making sure that multi-agency working is the key for a lot of people's recovery and getting back to addressing those support needs. And throughout my whole career experience being homelessness before, pretty much homelessness was never really solved with just housing. It was such a multi-agency approach, and those things are so important to make sure that we are addressing every need that this person may present with in front of us. Like I said, it can be tough and confusing for somebody to be surrounded by different agencies, but that's why it's so important that all agencies are working together and collaboratively, so they're all on the same page, they're all on the same message, they're all there working towards the same common goal for the client. So from our end, it's a lot about relationship building with our local community services. It's about the community services knowing who we are, so when we are referring to them, it's identified already that what path we're going to take with this client together to ensure they get the support they need. So yeah, I believe that throughout the whole sector, collaboratively, working together is absolutely vital. And one person having a little bit of knowledge about everything might not be able to address that need as much as ensuring that having a team around that person, team around me, is going to really support.
Thanks, Liam. Femi, did you have any reflections on that? Maybe from your own experience as well?
I mean, from what John and Liam have said already, they've pretty much covered it. It's useful if it's someone's first point of contact to have, like Liam said, the generalist who can sort of potentially make them aware of things, but a collaborative approach from specialized agencies is always far more beneficial in the long term. And as John mentioned, this initiative in Stoke-on-Trent sounds amazing, where they're all sitting at the same table and they can all together provide a unified support to a client or a service user. That is, for me, that would be so much more beneficial, and everything's covered. You could maybe even have a point of contact who tells the service user each of the people in the different agencies they'll be in touch with. That would be ideal, really, if you think about it. So yeah, what Liam said and what John has said about the work he's doing sounds brilliant.
Thank you. Hannah, did you want to talk a little bit more about what the whole person approach might look like based on the recommendations in the report?
Yeah, I guess I just wanted to focus a bit more on what it might look like within specialist services. So I think something really key that emerged was that practitioners should be aware and actively sort of, I guess, aware of the links between specific issues. So obviously we had some really positive examples around refuge, for example, where the primary need was domestic abuse, but they're also proactively just asking about other needs in all areas of life, and then sort of making the steps to link them up with other services as well. And I think that was something people really valued from specialist support, and people maybe even wanted to see in other services, which were maybe to do with employment. So just even if the practitioner is a specialist, just making time to have a more general chat about other needs that might have arisen or be linked to the one that they are seeking support for at that time.
Carmen, did you have anything to add to that?
Just what Hannah flagged in the presentation, that when we actually did the interviews, the interviews, more kind of needs were disclosed during that. So the primary and the secondary needs that the interviewees had ticked in their screening questionnaire. There's so much more going on, and I think they really appreciated certain services not just honing in on the need that they present with primarily, but on what else is going on for them, because people don't experience needs in silo. It's everything. They experience everything is happening to them, and how do those interact with each other. So yeah, just what the others were saying, really.
I just wanted to add again, yeah, particularly needs where there is like that higher level of stigma. People said we only sort of disclosed it during those more general chats, sort of once that comfort and rapport had been built, and they didn't feel like they were going to be judged. And I mean, things like that, I mean, particularly around debt or literacy issues, people disclosing them at a later point when maybe they'd initially sought support for a different need.
Okay, yeah. There's so much that you've talked about today that I find so inspiring, and just to hear about all the fantastic work that's going on. But then on the other hand, there's a lot about this that I find really depressing, because when I first joined the probation service in 94 or whatever it was, that's really what probation officers were doing. Was very much that sort of work of looking at what the kind of whole needs around somebody are, and then linking in with services that can help to support people in the community. And I'd just say there is a big body of evidence out there that's kind of supports some of that maybe we should be revisiting in thinking about how we can repurpose that for the new world. Chile, you've had your hand up for some time, so would you like to come in on this?
Yeah, thanks, Lindsay. I just feel inspired by what Liam particularly was saying, and Femi, I take your point, by the way, that putting a support organisation in magistrates' courts quite late down the line, or downstream or upstream, whatever you call it. So I really do take that point, but I do think going back again, this whole person approach is such a refreshing thing to hear, and I'm glad you're using whole person, not holistic, because holistic tends to mean advice needs. This is much deeper than that. This is everything: education, skills, employability, drug, the whole lot we talked about. So absolutely amazing stuff. But just go back to the comment made by our colleague around training for magistrates' courts, and also Liam, back to that earlier question or point about your relationship with, I don't know if you have magistrates or district judge at Highbury, but anyway, but the relationship with them. Because it always seems to me that even in the sort of lay judiciary, that they listen to themselves more than they listen to other people, and they're affected by peers. So I just wonder about whether there might be a way to use is probably the wrong word, but get the support of your magistrates or whatever it is, district judge there, to say actually this service does A, B, C, D or E for us in terms of facilitating how we work. Forget this cost saving for now, but anecdotal stuff. And just because the Magistrates Court Association, I mean, I don't know who sort of talked to them, but I did some training with them a few years ago as well. I just think that's a route as well. And I take Femi's point about it's quite late down the line, but there must be some options to make magistrates themselves more aware and educated about the reality of the world that many of the defendants have to come from, not in a patronising way, just in the reality of people's lives and poverty and lack of opportunity. And we should get them to fill a budget sheet in themselves. Most of them probably can't do it. But I think that's a route thing to go back to again about whether this can be done, something more effective, something direct can come out of this.
Thanks, Chile, because that is really important to know that there's been bits of work done about this, and also your comment about poverty and the kind of social circumstances. Again, there's been a comment in the chat about that we don't lose sight of that. So thank you very much. I don't know if there's any members of the panel who just quickly wanted to come back on that. No, because unfortunately we are now running towards the end of our time. So it comes to me to wind up the session for the day. Duncan has very helpfully put a link to the report in the chat. And has mentioned that we will also be sharing the recording from today so that we can highlight some of the really interesting discussions with other people who haven't been able to be here today. I'd like to thank all the panelists and particularly the researchers for their fantastic effort in pulling this piece of work together. The Centre for Justice Innovation would like to say thank you also for the Lloyds Bank Foundation for funding the research. And particularly, I think Lloyds is very good at finding these kind of places where different parts of the policy sectors interlink and how we can work together more effectively to actually address some rather large social problems. The Centre have said that they will be circulating the copies to attendees afterwards, and that if you would be interested in following up and having a discussion, then please do contact the Centre. I think this is fantastically interesting, and I very much hope to be meeting some of you again in the near future to think about how we can take this very important area of social welfare needs for offenders forward over the next few years. Thank you very much to everybody for attending, and I think the session will close now. Thank you.